Uh, Thank you for the invitation. Sort of like a homecoming. My parents lived in Belmont for over 15 years before they moved away. So, sort of, it's really nice to be back in Boston, and it's great to see so many faces here. So, today I just wanted to talk briefly about how we've diagnosed schwannomatoses. As you may remember from the introductory session, that Dr. Plotkin talked about the recent classification changes. And so, when we have someone coming in suspected to have schwannomatosis, what do we think about as a team to help make that diagnosis? So I'll just go through that a little bit with you guys this morning, or I guess this afternoon. I apologize, still on West Coast time. um, so Dr. Jordan said when he looked through my slides, I said I need to make extra sure that I was saying all the correct things because it's become more complex over the years, really emphasizing, even though it may seem simple and straightforward as I will go through these slides with you guys, it can still take many years to really make the diagnosis. So just keep that in the back of your head as I go through this today. So how have we classified schwannomatoses in the past? So it's really not very new in some ways. So in the 1800s, it was the first description of NF1 and NF2. And then just fast track a couple of, 100 years later or so, then it was described, we had NF1, NF2, and then schwannomatosis, as that, I think that's the sort of classification that we may be all familiar with in the past. And then most recently, as we all know, we have NF1 and then schwannomatosis. And under schwannomatosis, we have these classifications, which is NF2, LZTR1, SMARCB1. So those are the three most common genes that we see that are affected, that can cause schwannomatosis. Chromosome 22, not otherwise specified, or NOS, and not elsewhere classified, or NEC. And so of note, just for everyone to know, that all of these genes here, these first three, are on chromosome 22. So that's sort of the unifying theme there. And, we know that this is really a rare condition overall, but even when you look at the different schwannomatoses, depending on the gene that's affected, you can see how it even breaks down even further. So we all know that NF2 related schwannomatosis, where the NF2 gene is affected, is the most common one in schwannomatoses. So it's 1 in 25,000 births. Then you have SMARCB1 related schwannomatosis, which is 1 in 280,000. And then LZTR1 related schwannomatosis, which is 1 in 500,000 births. We have then 22q related schwannomatosis, where we don't really know maybe the specific gene that might be causing the schwannomas to form. But this is where we do genetic testing of, let's say, your blood or saliva. Some of you may have gotten that testing done in the past. And so that's where we can't find any causative gene that's there. But maybe you had a tumor removed for some reason, right? You had pain or it was growing. And then that's where we can determine that chromosome 22 was affected. So that's how we can make that diagnosis. Not otherwise specified just means that we don't have genetic testing available to us, or it wasn't performed for whatever reason. And then not elsewhere classified, which is we pretty much did all the testing that you could think of, at least available to us right now from a science and a clinical standpoint, but we can't still seem to find what's causing the schwannomas to occur. All right. So because of the genetic complexity in terms of diagnosing these conditions from a genetic standpoint, we still do rely a lot on the clinical criteria. So for NF2 related schwannomatosis, as we all know, the bilateral vestibular schwannomas is really the hallmark sign. So really over 95% of patients will have this finding. So you see these two vestibular schwannomas here, just as an example. And some other tumors that can happen in NF2, as we all know, do include meningiomas. So you see these arrows pointing to some meningiomas here, as well as ependymomas in the spine. So you do see those here with these little, with the arrows pointing those out. And so schwannomas also happen in NF2, as we all know, but are usually the only tumors that occur in non-NF2 schwannomatoses. So that's just a really broad statement. Obviously, there are really exceptions to that general rule, but just as a rule of thumb, just for us to keep in mind, because sometimes, we get questions from patients being like, well, I have this LZTR1 related schwannomatosis, but I'm hearing that my friend who has NF2 related schwannomatosis has all these different other types of tumors. Can I develop it? Could it happen? Certainly it might, but it would be very unusual for that to occur. Um, I am definitely not going to go through all of this, but I just put this in as a reminder that it is really a clinical criteria in terms of diagnosing schwannomatoses. So this is the latest classification in terms of the criteria that we use. So you can either meet, either you have bilateral vestibular schwannomas, for NF2 in particular, if we have these tumors removed for whatever reason, let's say you have a schwannoma removed and a meningioma removed, and we find the same NF2, what we call pathogenic variant, which is our fancy way of saying mutation, then that can really help make that diagnosis. Or you can meet two major criteria, as you can see here, or one major and two minor criteria. So of note in terms of minor criteria, you can count, for example, like ependymomas and meningiomas more than once to really help make that diagnosis as well. For the other schwannomatoses, really, I know this is a lot of text here, but globally speaking, usually if we remove two tumors for whatever reason, again, if you had pain from it and then you saw the surgeons and they decide to remove it and that would be the best action after talking with you, and then we find those mutations present in those tumors, at least two of them, then that can really help us make that diagnosis based on the pathogenic variant that we find. So that's just a global rule of thumb in terms of the first three schwannomatoses that we see, that you see here. So this is from the latest sort of classification flow chart that we use. So super complicated, so I won't go through this now, but if you really wanted to look, you can, there's a paper that you can reference and sort of walk through how we really do this. So, in terms of how we may approach this, right, globally speaking. So for step one, we would test your tissues so taking a blood sample or a cheek swab or saliva, right? So that, is not caught, it's not a tumor, right? It's what we call, like, it looks like a normal tissue, right? And so if, let's say, we find this pathogenic variant, or again, a mutation in NF2, LZTR1, or SMARCB1, we're pretty much done at that point, and we can really say that you do have that condition. If we don't find anything, we move on to step two, and that's where we would test two or more of anatomically distinct tumors. So meaning, like, you have maybe one schwannoma on your arm and on your leg, and they were removed for whatever reason. And so if you have a pathogenic variant in those three genes that you can see here, then that can help make the diagnosis. If there's loss of chromosome 22, we can say that that's chromosome 22 related schwannomatosis. If no loss of chromosome 22, we say not elsewhere classified, meaning, okay, we did all the testing that we could, we still really can't find the gene that caused it, and so that's where we can say it's not elsewhere classified. Remember, all of this is really in the context of your clinical features, so the tumors that you have, right, where they're located, et cetera. So you can imagine most of the time, patients get referred to, NF and schwannomatosis programs really when they find these tumors first, right? So sometimes, even though I've presented it as step one and step two, it can sometimes be the other way around as well. But I just did this just for simplicity, just so you know how we sort of think about it. To complicate things a little bit more, sometimes schwannomatoses have something called what we call mosaicism or segmental schwannomatosis as well. So mosaic schwannomatosis is where, mitosis, as you may remember from high school biology, it's the way our cells divide. And when our cells divide, if there's a mistake that happens a little bit later in development, you could have some parts of your body that are affected with the gene and other parts of the body that is not, right? So sometimes it's just like sampling error, right? So if let's say you had one half of an apple pie and the other half was a cherry pie, for example, and we just look at the cherry pie, well, we might be missing that the fact that the apple pie exists, right? So sometimes even if the testing is negative, it does not necessarily mean we can rule out that you have schwannomatosis because of this phenomenon. Other times it can really be just in a localized area, right? So, for example, maybe some of you in the audience also know people or yourself that might be affected where it's just like one arm or one leg that might develop schwannomas, and the rest of your body is pretty much all, you don't have any schwannomas present there. So in those cases, you could imagine, right, if we did a blood test or did a cheek swab, that could make it a little bit more difficult, right, to find maybe the mutation that we're trying to look for there. So long story short here is really help reach out to your geneticists and genetic counselors to help guide you. I mean, definitely I ask them all the time about it. There's a lot of nuances, for example, as Dr. Korf alluded to earlier in his keynote speech, there's different companies that are out there. There are different ways, different genetic testing companies test for these genes. So they're really the people who are really updated on the latest and greatest in terms of the technology. So I certainly rely on our geneticists and genetic counselors a lot when it comes to making these diagnoses. And so just to give a small example here, so you have chromosome 22, right? So again, as I mentioned in the beginning, you have LZTR1, SMARCB1, and then NF2 all on that same chromosome. So let's say you had SMARCB1 related schwannomatosis or LZTR1 related schwannomatosis. So we were all designed to have two copies of the same gene. So you see that here. So we see that if you have SMARCB1 related schwannomatosis or LZTR1 related schwannomatosis, you have that mutation present on one of the genes, right? And the other one is normal. So for tumors to form, the other normal, what we call allele, the normal copy has to be lost, right? So you see that here. So LOH is our fancy way of saying loss of heterozygosity. So meaning you lose that normal gene that you see here. And to complicate things a little bit more, for a schwannoma to form, at least how we understand it scientifically right now, is that you need to have an NF2 mutation on top of that as well. So you can see how that can get really complicated, right? So if we test a tumor, we see an NF2 mutation there, we might say, oh, you have NF2, right? If we don't know, for example, to look for the other genes that can also cause schwannomas to form. So this is one of my patients, for example, with SMARCB1 related schwannomatosis, just to walk you through this. So first, we had this is from University of Alabama, Birmingham. And just as a side note, this took about 3 years to actually make the diagnosis, right? And so here we have not only a SMARCB1 mutation here, again, that's a gene that's implicated, right? We know that that can cause schwannomas. So this patient had two different SMARCB1 mutations present in the tumor. And then, as I mentioned on the prior slide, you have an NF2 mutation present as well. And then you have chromosome 22 Q also missing as well. So how do you try to unify all of this and say, okay, so does this patient have SMARCB1, right, related schwannomatosis? Does this patient have NF2 related schwannomatosis, or is it chromosome 22Q related schwannomatosis loss, right? And that's causing her symptoms. And ultimately, we did the blood test, right? So the blood test where that's not a tumor, as we all know. And we found that this SMARCB1 mutation was present in the blood sample. And this, as you can see, which is a protein, right here, that is mutated, you see that that corresponds to the tumor that's seen there, right? So that corresponds to each other, this 82C that you see. And so that's where we're able to make that diagnosis of SMARCB1 related schwannomatosis in this patient. So take home messages, really, there are many different types of schwannomatoses. So I went over those 6 different classifications as it stands right now. But, obviously we are learning more and more about what genes are involved. And as you can see, that genetic testing can get very complicated depending on the situation. And finally, like, why is this all important, right? I think at the group session, we learned about, what we call the genotype phenotype correlations, right? So depending on the mutation that we find, how can that help us guide you and all of us, right, to help guide surveillance, right? For example, how often should we get MRIs? Or should we intervene earlier with surgery because we know that the specific mutation that you may have may mean that it might be a little bit more aggressive or something like that. And of course, as we all know, and I know Dr. Pocken will speak later to this as well with the Intuit NF2 trial, can also, inform treatment options as well. So that's it. All right. Thanks so much for your time.